Burnout and depression is becoming a significant problem amongst anaesthesiologists. So to talk about some of the challenges that clinicians face throughout their careers and potential solutions, I'm joined by Dr. Matthew Davies, President of the Association of Anaesthetists. Matthew, thank you so much for joining us. Tell me, first of all, what is the problem with depression, mental stress and burnout among anaesthetists and intensivists that we're facing?
Good morning, Simon. Thanks very much for the kind invite. I mean, I think it's worthwhile. So medicine is a stressful specialty. Medicine is a very stressful specialty, and the workplace that we work in is becoming more stressful. And then, of course, in the last 3 years, we've had the huge effect of the COVID pandemic, which has changed many people's lives for the worst. And in fact, we've yet to recover from the workplace stresses that COVID placed on us.
What tools are available for practicing clinicians to improve their well-being and increase their resilience?
So that's an interesting question. I'm going to turn it slightly around on you, because a personal thing for me is I don't like the word resilience, because that means that people, because medics themselves are very resilient people. They have to be. They've worked they've been trained to be so. The problem is we have a workplace that sets such a level of stress on people that doesn't matter how much resilience they've got. Changing the individual is not the answer. Changing the workplace is the answer. So there are currently lots of toolkits out there, certainly on our organisation, and lots of other organisations both across Europe have produced toolkits to how you can self-manage if you need help immediately, or if you want to change your department's the way of managing fatigue and other work like that. But I think the key thing to this is actually looking at the place we work and change the workplace. So
how do we do that?
Yes. Now, that's a $1 million question, isn't it, really? So how do we change what essentially is a lot of it is out of our control? So as membership organisations, as Royal Colleges across Europe, what we have to do is collaborate. We have to come together, and we have to advocate for the specialty of anaesthesia, but also joined up with other specialties.
And talking about the workplace as well, is bullying a problem as well? I mean, you talk about burnout and stress, but is bullying an issue as well, and is that on the rise?
Yeah, I mean, very topical really. In the last couple of weeks there have been some reports that have come out in this country in our national media about the level of bullying and harassment of various kinds in the National Health Service. We do have an annual staff survey across the whole of the National Health Service which shows the level of bullying, and it is on the rise. The Royal College of Surgeons have done some excellent work on this. They've produced together a lot of toolkits about how you recognise bullying, how you address it in the first instance, but how you change the culture around how we treat our colleagues, really.
And if someone's watching that maybe has seen this happening or is experiencing it themselves, what should they do?
So I think there are two people involved. There's the individual who's been bullied, they need to be looked after. Then there's the person who's done the bullying, and I think there's clear guidance to that person that needs to be highlighted to them. They need to be almost, you could use the word, called out on it.
And clinicians obviously face very difficult, stressful situations and catastrophes and critical incidents. How can they manage those best possible in their departments?
I think one of the key things, and certainly we've got some guidance out from 2015 around this, and just publishing it this year, around about how you structurally manage a catastrophe. Those involved on the catastrophe probably aren't in the frame of mind to actually lead the management of it. So there should be a clinical leader identified to come in, to look at what's going on, to look after the safety of the patient that's involved, to look after the safety of the staff that are there, step back, decide what happens next, and provide support going forward.
Just to finish, Matthew, you have a session on this here at the Congress. What would you really like people to leave your session remembering, if there was one thing, and kind of what's where do we go in the future? I know you spoke about collaboration, but what's the key message?
Yes, I mean, the point of the session we're going to run really is to sort of share what the journey that we've been through, look at the work the association has done, to try and involve and to collaborate both with European organisations and other countries around about how we as a specialty, as anaesthesia as a specialty, can look after what is effectively the most precious resource, looking after patients, and that's the clinicians.
Well, it's such an important topic, Matthew. Very best for your session, and thanks for joining us today.
Thanks very much, Sam. Thank you.